Today, we're going to talk about one of the most important and frequently asked topics, SMA progression. Understanding how SMA progresses can help individuals, families, and caregivers better prepare and manage this condition. SMA progression refers to how the symptoms and physical effects of spinal muscular atrophy change or worsen over time. SMA is a genetic disorder that affects the motor neurons, the nerve cells responsible for controlling voluntary muscle movement. As these neurons deteriorate, muscle weakness and atrophy increase, leading to changes in mobility, breathing, and other bodily functions. The rate and extent of progression vary widely depending on the type of SMA and individual factors. SMA is classified into different types, Type 1, Type 2, Type 3, and Type 4, based mainly on the age of onset and severity. Type 1 is the most severe and usually shows symptoms within the first 6 months of life, often progressing rapidly. Type 2 and 3 tend to progress more slowly and vary in severity. Type 4 typically starts in adulthood and progresses the slowest. Individual differences like genetic makeup, the number of SMN2 gene copies, overall health, and access to treatments can also influence progression. So, two people with the same type of SMA may experience very different journeys. The most noticeable sign of SMA progression is increasing muscle weakness. This might mean a loss of ability to walk, reduced arm or hand strength, or challenges with activities like sitting up or swallowing. Respiratory muscles may also weaken, leading to breathing difficulties. Over time, contractures or stiffness in joints may develop, limiting movement further. Some people notice changes gradually, while for others, symptoms can worsen more quickly. Monitoring changes in mobility, muscle strength, breathing, and swallowing abilities is important to manage SMA progression effectively. The speed of progression varies greatly. For infants with Type 1 SMA, progression is usually rapid without treatment, sometimes causing significant muscle loss and respiratory issues within months. For those with Type 2 or 3, progression might be slower and happen over years or even decades. Type 4 often progresses very slowly. Disease-modifying treatments have changed the typical course of SMA for many people, slowing progression and improving motor functions. Early diagnosis and treatment often lead to better outcomes. Currently, there is no cure for SMA, but several approved treatments can slow down or alter the disease's progression. Medications like Spinraza, Zolgensma, and Evrysdi work by increasing production of the SMN protein, which supports motor neuron survival. Many individuals on these treatments experience improved muscle function and slower disease progression compared to untreated cases. However, the extent of improvement depends on factors like age at treatment start, SMA type, and individual response. It's crucial to start treatment as early as possible for the best results. Doctors use various tools to monitor SMA progression. Physical exams assessing muscle strength, motor function tests like the Hammersmith Functional Motor Scale, and pulmonary function tests to evaluate breathing capacity are common methods. Regular checkups help detect changes early and allow healthcare providers to adjust treatment plans, therapy, and support as needed. Care teams often include neurologists, pulmonologists, physical therapists, and other specialists to offer comprehensive care. While SMA is genetic and its progression is primarily influenced by biology, lifestyle factors can impact overall health and quality of life. Staying as active as possible within safe limits helps maintain muscle strength and flexibility. Proper nutrition supports muscle health and immune function. Avoiding infections, particularly respiratory ones, is critical since weakened muscles make breathing harder. Working with healthcare providers to maintain a healthy lifestyle complements medical treatments and can improve outcomes. Families should monitor for increasing difficulty with mobility, such as loss of ability to walk or move arms freely. Watch for signs of respiratory decline, like shortness of breath, fatigue, frequent coughing, or respiratory infections. Swallowing difficulties or choking episodes are also red flags. If you notice any of these signs, it's important to communicate with your healthcare team promptly to adjust care or treatment plans. Early intervention can help prevent complications. Currently, SMA progression cannot be reversed, but disease-modifying treatments and supportive care can slow down or stabilize symptoms and sometimes improve muscle function. The goal is to maximize quality of life and functional ability for as long as possible. Ongoing research holds promise for future therapies that might offer even more significant benefits, including potential reversal of damage, but these are still in development. As SMA progresses, individuals might face increasing challenges with daily activities such as walking, dressing, feeding, and breathing. Adaptations like mobility aids, home modifications, and respiratory support can help maintain independence. Emotional and psychological impacts are also important, as adjusting to changes can be difficult. Support from family, friends, and professional counselors can help individuals cope with these challenges. Early diagnosis is critical. The sooner SMA is diagnosed, the sooner treatment can begin, which often means better control of disease progression. Newborn screening programs have made early detection more common in many countries, enabling early intervention before significant symptoms develop. This early start can improve motor function and overall outcomes, highlighting the importance of awareness and testing. Without treatment, SMA progression tends to follow a predictable pattern based on type, often leading to worsening muscle weakness and complications. With treatment, many individuals experience slower progression, improved muscle function, and fewer complications. Treatment effectiveness varies, but overall, medical advances have dramatically changed the outlook for many living with SMA. If you found this video helpful, please hit the like button, subscribe for more content, and share your questions or experiences in the comments below. Your stories and support help build a stronger SMA community.